Anticoagulants are used to treat conditions of excessive coagulation, that is, thrombosis. Platelet-rich thrombi are also called as white thrombi. They form in the high flow rate and high shear force environment of arteries. Occlusive arterial thrombi cause serious disease by producing downstream ischemia of extremities or vital organs, and they can result in limb amputation or organ failure. Venous clots tend to be more fibrin-rich. They contain large number of trapped red blood cells and are recognized pathologically as red thrombi. Deep venous thrombosis can cause severe swelling and pain of the affected extremity. But the most feared consequence is the pulmonary embolism. This occurs when part or all the clot break off from its location in the deep venous system and travels as an embolus through the right side of the heart and into the pulmonary arterial circulation. Occlusion of a large pulmonary artery by an embolic clot can precipitate acute right heart failure and sudden death. In addition, lung ischemia or infarction will occur distal to occluded pulmonary arterial segment. Such emboli usually arises from the deep venous system of the proximal lower extremities or pelvis. Although all thrombi are mixed, the platelet nidus dominates the arterial thrombus and the fibrin tail dominates the venous thrombus. So we can say that vitamin K antagonists are used to treat venous thromboembolism, deep vein thrombosis, pulmonary embolism, and atrial fibrillation. Actually, vitamin K antagonists are highly effective drugs. In chronic atrial fibrillation, they reduce the risk of stroke by up to 60%. The correct dosage can be monitored using the INR laboratory test as we discussed before. Vitamin K and factor concentrates are available as antidote in the event of overdose or bleeding. Yes, bleeding can be a serious side effect of these drugs. What are the other adverse effects of vitamin K antagonists? Let's move to next section to learn about them.